Thank you very much for inviting me. It's really great pleasure to be here. And as Tamsin said, I will focus in the next 30 minutes or so on research papers, on the way the papers are written, how well we can use them, what are the main issues, and what can be done about it, so we can all write papers which make true difference and impact. The word impact has been one of the most spelled out words in recent months and probably will continue to do so. Why do we focus on research articles so much in 21st century? It's still the key vehicle in sharing research findings, despite of many other advances, online publishing, sharing. But the way we read them and use them has changed quite dramatically. And there has been some studies looking into how people read research articles, and the time when people read journal from cover to cover is long gone. We search very purposefully for papers, we locate them in databases, and that obviously puts different requirements on research papers, the way we read them, the thoroughness and so on. So I will elaborate on this a little bit more. And very often those short papers, a couple of page papers, are the only information we have about research study. So ideally, if we want to learn about this piece of research, we need to find all this information in the paper. And it's very often challenging because this information should satisfy different types of users. And I don't know how many of you have been at any scientific writing course, but the teachers, trainers, they usually start with the sentence, you always have to have user in mind. Focus on user. And then there's this very amorphous sort of user, which we all know we have to center on users' needs, but we never quite, or at least up until recently, I've never done it much, I'm writer, and I'm reading paper, and I'm a reader, and it's very difficult to imagine who specifically will read my paper. And I think this is a really important distinction, that we need to think about readers and users of our research much more specifically than we generally do. And for us in medical research can be clinicians, can be another scientists, and more increasingly patients. And they have very different requirements and ways. They quickly scan, they want everything preferably digested in a title, or systematic reviewers, researchers, they really give your paper thorough scrutiny. So if you really think about how my research paper can be used, one of the most important uses in medical research is that every piece of research should be potentially includable, if that's the right word, in a systematic review. So that's very specific use. So if I give you some examples, has anybody done systematic review? So for those who haven't, this is just very quick reminder of key steps which are involved when we're developing systematic reviews. And Cochrane Collaboration is one of the organizations which develop very robust approach. So the review usually starts with formulating very clear focused research questions. Reviewers establish eligibility criteria and then very robustly search, select studies, extract data, hopefully. Very important step is assessment of methodological quality, and if it's possible, you synthesize findings using statistical methods. If not, there's some qualitative synthesis, and you present your data and result and interpret the findings. So those are the key steps involved in systematic reviews. And I highlighted in red those which are most dependent on the quality of writing, on the quality of description of your research you put into the paper. So to give you an example of what I'm really talking about, I selected very important review which was published a couple of years ago, and the review investigated if the supplementation of vitamin A reduces mortality and morbidity in very young children. And it's an important question for developing countries. And I'm not specialist in tropical medicine, so the examples I'm going to give, I'm looking at them from pure reporting angle. So if you discuss things, we won't discuss any clinical issues, because I know this piece of research, it brings lots of questions on the clinical side as well. So I will focus only on reporting. The review has been published as a research paper as well, and I'm highlighting it because it's one of the probably best written systematic reviews published as a research paper I've seen. The review itself was very robust, and the paper is absolutely excellent example of good reporting. So just because we usually highlight bad examples, I thought I'd highlight this one as well. And the review formed the basis of WHO guideline on the topic. So going back to those key steps, what systematic reviewers have to go through, one of those is assessing the risk of bias. And here we focus predominantly on methods and obviously results, but we're assessing how reliable the findings are, how robustly was the study done. And in order to assess if the methods employed in the research were good, or done poorly, or not done at all, we need description. And if it's fully described in a paper, we can then make a decision if it was done badly, poorly, or not done at all. But if it's ambiguously reported, or not reported at all, we can't say if somebody just omitted this information, or if they haven't done it, or how well they've done it. And it's very, very problematic, because if you know something has been done badly, you can take some steps and considerations. But if you don't know, it's very, very difficult. So Cochrane Collaboration developed this beautiful tool where they ask key questions which relate to robustness of clinical trials, and questions they pose, or each review poses and tries to find answers in every trial. Included is: how was the randomization sequence generated? How was the allocation into treatment groups concealed? What about blinding? Were the participants blinded? Providers of interventions, were they blinded? And were the outcomes assessors blinded? Is it possible that outcome data are only incompletely reported? Is there presence of selective reporting or any other bias? And they try to judge from the information provided in a study if it's possible that something has been done in a way it can introduce bias. If it can introduce bias and the risk of bias is high, then there's this red dot. If the study was done well and the risk of bias is low, it's green dot. But if we don't know, if the information is unclear, then it's yellow question mark. So, one of the papers which I really picked fairly randomly and fairly quickly from the review I showed you at the beginning is this paper. It's by Philip Donnan, and it's quite a long paper, and it's written quite well. When you read it as a paper for interest, it's written in a very engaging way, gives you lots of details, there are 4 tables, very dense, and you believe you understood the study quite well. And I've done it several times at various workshops. When people don't have a purpose, they're fairly happy with the way the research is presented. But when Cochrane reviewers assess methodology of this trial using very targeted questions, which I just showed you, you can see how poorly this paper scored. They couldn't answer with certainty almost any questions. So if I look more closely into this review, because it's a really important piece of research to demonstrate a few more points on research reporting. This review included 43 trials, over 200,000 participants, but they could include only 39. 4 trials didn't present data in the form that can be included. It was either incomplete or missing. So we already have 4 trials which we have to exclude even if they should contribute it. 3 trials were classified as high risk of bias for sequence generation. In other words, they were not truly randomized. That's another 40,000 participants. But what's more important from reporting point of view, the information was unclear in 24 trials. This is more than half. 1 trial was at high risk of bias from inadequate concealment, but again, unclear in 27 trials. And we can go on. When it comes to blinding, unclear reporting in 14 trials. Project staff, which delivered the intervention, unclear in 13 trials. And it's not just unclear as unclear, but unclear in relation to that it could have included bias in the study. 9 trials, missing data, which could have potentially be dangerous, but again, unclear in 12 trials. In 24 trials, unclear if they reported on all outcomes, they said. And only 3 trials reported adverse effects, which are associated with vitamin A supplementation. So you can see that overall, it's fairly grim state of reporting on a very, very important topic. And I should also say that the publication of those trials, it didn't really matter if those trials were newer or poor. The trial I showed you, I believe it was from 97. One of the largest trials was from 95, and a very poor reporting of those key methodology items, but some of those from 90s, they provided good information. So generally there's a trend, but what about locating all published studies? Searching for trials, very important. As you probably know more than I do, DEFTA trial, famous DEFTA trials, which is probably the largest randomized trial, conducted between 1999 and 2004. In the time this review has been conducted, was still unpublished. So systematic reviews, as they are quite rightly taught, contacted authors, but authors didn't provide any information about study methodology. They just shared their preliminary results. So the systematic review, when they combined all trials they could possibly, those 39, they found 24% reduction in childhood mortality. DEFTA trial, which has been published in Lancet in April 2013, found non-significant reduction. However, I'm not a statistician. Through various statistical analysis, DEFTA trialists and systematic reviewers, they conducted sensitivity analysis, and by incorporating those results, they arrive at the half of the mortality reduction. So if we omit the factual results, what that actually means, what I wanted to demonstrate here is that missing studies, which we can't locate, which are unpublished, can have incredibly important and big effect of our own thinking about the effectiveness of various interventions. So that's the message I wanted to say. And there's a lot of evidence that many trials or other research studies never get published. So all these deficiencies, I must say that this review is not the only review which would display these deficiencies. Non-reporting studies I just mentioned, incomplete reporting where information about study methods, intervention, how was the intervention, what actually people delivered, selectively selecting just some outcomes, not perhaps reporting on those I set to measure as primary outcome, but selected some of those which seemed to be much better after I finished the study, or misleading readers through clever use of words. Those are unfortunately very common, and as I just showed you, they really hamper the work of systematic reviews, and everybody who raised hand before, they know what sort of frustration I'm talking about, because it's really, really hard to make sense of all those papers. And as I mentioned, they are very, very common. So apart from impossibility of then compare findings across studies. The findings we find, it's very how reliable they are. It really poses lots of questions. When we do not have methods described thoroughly, we can't replicate them. We can't reproduce the findings. And it's very difficult to implement those findings, even interventions which are deemed very efficient. We can't then implement them in practice. And when the intervention's not simple as simple drug administration, but something more complex like exercise regime or diet, it's even more complicated. So what to do and how to avoid those deficiencies and what we can do when we write research papers. So when I finish research study, it's not that easy as it sounds. I have loads and loads of notes, lots of information, loads of data, loads of tables, graphs, lots of things. And how to turn all this massive information, which sometimes is really, really high, with all study reports, into 3-page manuscripts, 3,000 words. It's a nightmare. Nightmare. So, and this is where I'm coming from, and I'm biased, obviously, because part of my job is to promote the use of reporting guidelines. Reporting guidelines are help for people to basically not to forget the important information other people will look for in your research papers. Unlike journals' instructions to authors, reporting guidelines focus on scientific information, like the ones we just been through when we discuss risk of bias assessment. And in a way, they're like shopping lists for scientific items, and they remind us, helping us not to forget, because research is becoming more and more complex, and it's so easy to forget, not only for people who are starting in research career, but also for those who are much more experienced. So this is example of one of the most known guidelines. It's a consort statement for reporting randomized controlled trials, and you can't really read it here, and it's not my aim to go through individual item, but basically guidelines such as consort, they provide whole framework for writing paper, from what you should include in the title, that you should identify your study as randomized trial, which then helps in identifying your research papers through electronic searches and so on. So from very pragmatic, practical information to methods information, how you describe your randomization process, participants and all this. So it takes you through the structure of the whole paper, and it's very, very helpful. Many journals, not just Lancet, but obviously that's our aim is to aim high. Many journals now require authors to follow reporting guidelines, and it's problematic if you never heard of them and you hit the submission software and there's this barrier. We want you to comply with this reporting guideline. And more frequently, they also ask you to complete the checklist, and I hate forms, I must say, but by filling the checklist, in a way, you did the first reporting audit of your paper. When you go through it systematically, you check if the paper is complete, if you really didn't forget any important information. So what might seem as mindless bureaucratic requirement from journals' side, and it's very often put like that, submit this, it's actually extremely useful exercise, because in a way, you make sure the paper is as complete as possible. If you haven't done something or something is not relevant for your study, you can put short sentence in the paper, and then it's immediately crystal clear that it was not relevant or haven't been done. So the program I worked on is called EQUATOR. It doesn't have to do anything with nice, warm, equatorial countries. EQUATOR stands for Enhancing the Quality and Transparency of Research, and we started almost 10 years ago people who were frustrated by exactly very hard work on systematic reviews and frustrated by poor quality of reporting, we started making it easier for people to find reporting guidelines, because people like authors of the consort statement, they publish consort, they saw it's brilliant aid, and they hope that people will go find the publication, say, it's really, really good, we start using it. And guess what? It didn't happen, or it happened to very, very limited capacity. So people find it very difficult to locate help like this. So we develop online portal, which is not that difficult, and we set to collate all reporting guidelines which had been published for various study designs or clinical situations, and put them into one place, so people who come to our website, they can easily find reporting guidelines which is relevant to their study. Sometimes more than one guideline is applicable. For example, if you do trial, very often you do a bit of qualitative research associated with it, or economic analysis, so you have to look into more than one guideline, and all of those are fairly accessibly available on our website, and we try to link them as much as possible to make it easy for users to use. For people who are not that experienced in writing, like the Global Health Network does writing months in November, we try to collate resources, good resources on scientific writing and so on, because many books have been published and some of them are quite frankly unusable and very, very sick, and it's difficult. So we collated those resources where we have very good experience with their use. So apart from resources, we're trying to raise awareness of those problems, because many people don't realize that if they don't write everything or the key information in the paper, how far-reaching consequences it has many, many years later, because you know that in systematic reviews we now go back 20, 30 years. So sadly what has been published stays here forever. But we're also trying to support people through training and education. We run a lot of courses, and all of those are available through our website. And our website is very heavily used, and it's rising all the time. We also do lots of lectures, published books, so we're trying to make reporting guidelines accessible. I already mentioned that we run courses. We're trying to do quite a lot of face-to-face courses, because online courses are very good and they reach large number of people. But face-to-face courses, they have also their place when you want to practically change people's skills. So there's a place for everything. So our focus is mainly on research publication, and that's where we started. The problem is, you maybe had this experience personally when you submit your manuscript to the journal. Reviewers then come and they say, I think they should have done this step completely differently. And that's a problem, because you have done the study, you pass this point, and it's completely pointless advice at this point, because you can't change anything. So we decided that we need to broaden our horizon and start supporting people when they're planning research. And you need this knowledge, what you need for publishing, when you're planning your research, plus a lot more. So before you start thinking about your research, you should really look much further ahead what you will need when you publish it. So what I presented when I look at this vitamin A systematic review is now developing new stream in research. More and more scientists are looking into published research, available research, and they're starting to scrutinize how well we do research, how well we conduct. Basically, they're looking into all processes around research regulations and how effectively we are carrying those. And I'm not sure if you follow this type of literature. It's quite depressing. And so there are new initiatives budding up to do something about it, because we spend lots of money. We, as scientists, we feel it's not enough, but it's still lots of money, and lots of it's wasted. For example, the Reward Alliance, which started in 2014, which with much more down-to-earth name based in research. They look into areas where avoidable waste is occurring in research process. And I'm not going to go through this, but they look into what type of research we do. And in clinical research, very often we carry out projects which are of interest to investigators but have no bearings on what patients would like to know. We discuss various shortcomings, very often fatal in research design, where you can't find answers to the questions you set to find, and those are very common. I sit here in Oxford, there are 3 research ethics committees, NHS ethics committees, and it's really surprising how often we see at the stage of ethics application very badly prepared research protocols and studies. So regulation of research, everybody who went through this ethical process will now sigh, because it's very bureaucratic, and I'll refrain from opinion. And I already mentioned unusable publications. So Reward Alliance is trying to do something about minimizing this avoidable waste. And I talk mostly about clinical research when we're conducting trials, observational studies, or pragmatic trials in practice. But as you can see, in a way, it's research continuum. Every single stage in research or type of research is dependent. How successful we are in clinical research when we're trying, for example, new drugs in randomized controlled trials depends on a large extent on preclinical animal studies, how well were those done, and how well were the laboratory studies done in the basic research. And there's lots of buzzwords, translational research, and so on. And we have to push so the early phase discoveries are then translated into findings for patients' benefits. Those are all buzzwords, but they have very real cause. Research is not designed well, and if something is done in not a great way in the lab or in animal research, then it provides very poor basis for larger trials in humans. And lots of work is now going, particularly in the preclinical animal research. And for example, the scientists at the University of Edinburgh, led by Malcolm McLeod, fantastic research, which again, very, very depressing, opening our eyes how unreliable certain things are. Research funders are waking up to this fact, because we all know that they put lots of effort into selecting what research they're funding, but they don't care that much what comes out of it. But it's changing, and for example, last year in America, NIH institutes, they already put some measures into practice how to increase reproducibility of research and reliability of findings, and that relates to grant assessment, design of project, and so on. Very robust set of measures which they implemented and now assessing. But here in the UK, a couple of months ago, there has been a meeting conducted by the MRC, Wellcome Trust Academy of Medical Sciences, and recently a report has been published about reproducibility and reliability of biomedical research, which identified strategies how we could increase all these deficiencies. Not increase, how we could increase the reproducibility and improve the conduct so that science provides much better foundations. And the report's available online, and I'm talking about research reporting. Use of reporting guidelines has been highlighted as one of the ways how to improve completeness of research reports. Obviously, we have been very traumatized by REF exercise. Another one is coming up in 2020. But couple of days ago on the HEFKI website, there's very short digest, lessons learned from this exercise. And researchers who deliver high quality academic research also deliver high quality impact. And the word impact and true impact of research, I think it's common sense to assume that if we do good science, then it will impact in a good, reliable way. So something to consider. So now coming back, I believe, very last slide to the title of my talk, how to produce research papers that makes a difference. Good science. Good research planning and study design. I'm based at the Center for Statistics in Medicine, and lots of people still assume that statisticians are people who only work with data when the study is done. And this is something which really horrifies them, because those people should be involved in study design from the very early stages, and they help researchers to avoid lots of shortcomings and design study in robust ways. So the chance that you find the answers is really good. And good reporting, accuracy, completeness, transparency and timeliness, not to delay publication, completeness, where the reporting guidelines can help. So I think those are the things which really help to make papers which really do count and make your research count. Thank you.